Okay. Okay, hi everyone. We're about to get started. 30 minutes, one question, one follow-up. And I'm going to turn it over to Dr. Williams now for some brief remarks.
Yes, good afternoon on our first quite warm weekend of May in the spring. And so I have some numbers today for you, and also noting that there's quite a few people out and around. I do see a mix of people adhering and keeping the physical distancing, and I see some doing so less, but I see a lot of people wearing facial coverings in closer contact and being cautious. So again, the key message is that enjoy the outdoors, do so carefully, continue the physical distancing. As we will talk about the numbers here, while it's coming down slowly, it's having its ups and downs, and we'd like to see it progressing even quicker. That means everyone needs to adhere to the physical distancing, as we're not yet disrupting community transmission adequately at this time. So we want to stick to the task. So on our numbers, as of 4 p.m. yesterday, we had 511 new cases reported in IFAS. That brings our total up to 17,119 confirmed cases of COVID-19 in Ontario. The demographics still, we have more females than males. The spread is about 10 to 15%. And most of the cases are 44% or 45% are 60 years of age and older. And a lot of them are in the Greater Toronto area, about 60%. The number of healthcare workers testing positive, cumulative up to this time, is 2,540, and in that number, so that's cumulative since January. We continue to see many people resolving, with now 67% or 11,390 of our cases have resolved, and that is good news. And the number of people in the hospital has decreased significantly today. So on that side there. On the other side, there's 977 people in the hospital, with a decrease of 40. The number of people in ICU has decreased a bit, as well as those on ventilators have decreased quite a bit, by 21 to 154, while the ones in ICU is 221 at this time. Tragically, we still see deaths accruing related to COVID-19. To date, we've had 1,176 deaths reported. That's an increase of 55 deaths over the previous report. With respect to long-term care, in their data, they have 167 active outbreaks in their database, or in our IFAS database, as compared to theirs, which has the resolved cases that reduces that number. That has only increased by 910 deaths, so that's an increase of 49 from the previous report. And there have been 2 deaths reported among the staff in that regard there, as a report of a third. So 61 homes are in outbreak in the retirement homes, 571 cases. That's an increase of 16 in the residents. And on the staff side, it's 251 today, and that's a decrease as they continue to rectify their data and information. So they had an increase of reported 3 deaths among the residents. The total tests completed in Ontario is over 310,000. That's 359. And in the last 24 hours, we did 16,305 tests, so fairly similar to what the day was before. And we have still 12,829 queuing up to be done today and to get completed tonight in that. So overall, in the data and information there, the testing continues to be robust with over 16,000. More tests coming in as we continue to do the testing of all staff and residents in all long-term care facilities in Ontario, while continue to see people in the assessment centers with mild or wide varied symptoms that are indicative of a possible corona or COVID-19 infection. And so that's still occurring. Our numbers, as you can see, we're up to 511. That's an increase from yesterday's in the 421. But remember, just back on Tuesday, we had 525. And even last Friday, or a week Friday, we were at 640. So as I said, the numbers are not coming down this way. It tends to have these ups and downs, and that depends on the data and the inputs into the IFAS system, which may sound confusing, but you have to let that settle down. As we see when the data is completed, it looks like we're still in around that 50% mark, that the total is from long-term care and the other 50% is from the community side. So the community side is still trending in the mid-200s, in that range there. So we would like to see that come down even more assertively over the next number of days as we go into this next 2-week period, to give us greater confidence to address potentially change in our public health measures. So the key message is stay at the task, as we would like to see that worked on and to see that come down quite considerably, well below 200, heading down to get our R0, the so-called transmission rate, well below 1. So while you enjoy the outdoors, while you're getting out and around, plan ahead, do so carefully. You have to keep your distance, keep healthy, and if you have to, for a brief moment, come contact, or for extra protection, you can wear a facial covering. So all those same messages are the same as before. We just have to be consistent at doing it and keep doing it as we try to get those numbers down extensively over the next week especially. So with that, I'm going to open up for questions.
Okay, we'll move to the phone lines.
Your first question comes from Carrie Virama with CBC National News. Please go ahead.
Good afternoon, Dr. Williams. We're hearing that a PSW who worked at Downsview Long-Term Care has died of COVID-19. Her union says this is their third member to die of the virus and is saying long-term care facilities need more PPE. And this is a part of the question that I've asked you a number of times. Some are still not following infection control measures that you have recommended to the Ministry of Long-Term Care. So are you able to provide any details surrounding this latest PSW death? And based on the scoring, the red and yellow and orange systems you were talking about in the last couple of Saturday press conferences, can you chat a bit about some of the extra measures you're putting in place at long-term care facilities?
So, yes, I have heard a little bit about the unfortunate passing of the PSW worker at Downsview. I understand it's under investigation with Toronto Public Health. I don't have all the details because I only heard about it, and I understand, but it's a long-serving member, and that's unfortunate. So we would need to be informed by the full investigation to understand all the factors that might have been involved in that. And I think on your question is the one that we've been addressing assertively with the, we call the Incident Management System Lead Table for Long-Term Care under Dr. Kevin Smith, that we're looking at, one, assessing all the homes as quickly as we can, assessing them from the standpoint of testing, assessing from the standpoint of their infection prevention control practices in place, assessing them from the standpoint of their personal protective equipment and what they're wearing, and further the adherence to all the standards and directions in that regard, including adequate staffing that is right for the proper provision of care and services to the residents in these homes. So in this case, I'm not sure when the person contracted, how far back, because as you remember, the event, usually the incubation period, even with positivity, is a number of days, and then from that to actually having illness and then getting more severe has more time. So we're looking probably back at 7, 10, or 14 days ago. So we hope that, as our plan, as they go assertively at the homes that are the reds, they feel there's concerns in any of those points I said, assessments, have been worked on and amended, and then the yellows considerably further, and greens, and doing the whole system. So that's the target of the IMS table under Dr. Smith, as well as working with Ontario Health and with the Ministry of Long-Term Care to work as quickly as they can to make sure any gaps in services, any gaps, any of those 3 points I mentioned have been addressed, and if not adequate, are rectified as quickly as possible. And that is guided too by the ongoing testing and survey that we're undertaking assertively at this time with all long-term care homes and residents and staff.
Okay, before we get to our follow-up, I would just encourage others who might be on the line to get into the queue. Otherwise, this will be our last question.
All right, thank you very much. And it's a question I asked the Premier also. We've been seeing the number of infections, the number of new cases, been slowly whittling down. We appear to have peaked And so with that, what recommendations have you been giving the Premier about, for example, what would a summer look like in Ontario if we continue to see positive developments with a decrease in COVID-19 cases?
Well, our general aspect was our framework that we gave, the Public Health Measures Table gave to the Premier and Cabinet on these different stages. And it is our hope that as we work assertively at bringing down the community cases, that in those stepwise patterns that might actually occur into the summer and to make that impact. We were hoping to make strong gains over the month of May, especially, so that's setting up for June and into the summertime of July and August. It is our assumption that while we may get those numbers down, we may get to have small number of cases that are contained through case contact management, that it wouldn't be totally absent from us over the summer. And some have predicted, some modelers, that we might have another wave, not as big as the first one, but another wave in the early fall in there. So I think while we may come down to a lot of other activities might be resuming in time, and that's our hope, with the framework laid out and with the right metrics driving the decision making, it wouldn't be that it's already back to total the way it was. We still have to have some of those steps in place. So as I said, it's going to be very much you can go back to this, and you may resume this with the caveat of having to do this and this as we keep our guards up in the summer and into the fall. So we're looking for that right balance of some resumption of activities, quite a bit, but also with the caution in there to be taking those extra measures, personal hygiene, some spacing, distancing, and being aware of those in contact and risk situations that you would want to keep under control, and so that we might be able to maybe even avoid a wave in the fall. But that's a long way off in our period of time. Let's see what we can do in May, and that's why I think we're really trying to bring that message back. Now's not the time to just throw things off and be casual. We need to still be vigilant in all our activities in order to bring this one down and to stop the transmission in our communities. So that's my message for the public is while the weather's looking good, we'd like the data to look even better.
Next question.
Your next question comes from Morgan Campbell with Global News. Please go ahead.
Thank you, Doctor. Just expanding a little more on that. So there were some protesters at Queen's Park again this Saturday. You go out and about, and you do see people who are pretty close. Expand a little more on how important it is right now to pay attention to this social distancing, and how are we monitoring it? Are we monitoring it in a way that's effective enough so that in the future maybe we can move away from these heightened emergency restrictions? How important is it to pay attention to the happenings right now, so that maybe we can see somewhat of a regular summer?
So thank you for asking that question. And you can see with our number today, 511, if you say 50 to 50-odd% are from community spread, you bring that number down to the mid-200s, 260 or whatever. That's 260 daily, between 225, 260 each day. That accumulates a fair number of cases where individuals, going back a number of days before, because it takes a few days, were in contact with someone with the infection. It doesn't just happen by chance. And if you know that, you understand that, then that means that spacing was not being undertaken at that time. Because we've said before, with the droplet spread and the aspects, it doesn't go wide distances, 10, 20 feet. You have to be in contact with a person fairly close for a period of time, not just like half a minute or something like that walking by. It's that close contact, and that's why we're saying you have to keep at that, because that can keep the spread going, and that one person gets it and they do the same with casual other ones, and you start having 4 contacts for one case, then you have 5 with those 4 contacts, and it just keeps ramping out, and you start losing your control again on that management. So it's this time we really have to be assertive and aggressive, and as I said, a lot of our cases are still in our greater Toronto area, Some of our rural and remote areas have been showing much better data on keeping the numbers down in that. Some of that is, of course, they're less dense urban populated. And that's a challenge that the people in our areas around here that you're alluding to, some gathering to protest in that aspect. One could, I still think if you had some issue with that, you could still do a 6-foot distancing and wear proper facial coverings and that. I'm not trying to encourage anything, but I'm saying the activity is whatever you're doing, walking or going out and different things, keep the 6-foot distance, keep the facial covering in that so we can stop and break up the community transmission and get down to containment again in there. But if our places in Toronto and that are adding 200 new cases daily to the numbers around the Greater Toronto Area, and each one has 4 to 5 or 6 contacts, you're going to see the workload and the demand that is to try and bring that under control. It can be negated by the fact that people just did the spacing over that 14-day period and keep at it consistently. So it's very important at this stage if we're hoping to bring this down, because when we get that down, we can contain it, then we can move to the next stage and the next stage after that as laid out by the framework model and the public health measures table that would be using that along with a lot of other metrics to advise the government when they might want to consider that, and the government can then choose to do the stages when they want to initiate that and undertake to enlarge or resume, as I say, the government and the economy of the province with all the different sectors of the ministries laying that out in each stage as they go through that process. So a lot ahead of us, but we need to have that consistent behavior, that consistent task of doing the distancing and trying to get those numbers down significantly, or especially over the next 2 weeks.
Follow up?
And as some employees and businesses prepare to open on Monday, what kind of advice do you have for those individuals that are heading back to work, amid this pandemic? In addition to clearly respecting physical distancing rules.
Well, yes, and that's why we have a few days for them to get ready. They're returning back, and that's the good news. They've been doing the physical distancing. I think they're concerned, as they should be, for themselves and their family. They want to make sure that even though the risk may not be huge, especially if they are in the setting, it can be reduced considerably if they are following the rules, if their industry, their location that they're going to has that continuing, the 6-foot distancing. If there's some retail function, there's the proper curbside pickup that's being handled with that kind of respect for the people coming as well as yourself. And so I think they're going to want to really get into that thinking of, it's not like when you left it a month ago, 5, 6 weeks ago. It's different now. And you want to get your mind into that thinking, into that norm that you've been doing in the home setting, around the home community, you want to do when you're on the job to continue that, all those aspects I've noted. And that's been our main message, that even though they're doing these other ones, they will do it within the framework of the pandemic control of the distancing as well as facial covering, if and when necessary, that they have to get in a potentially compromised position. But we're confident they can do the distancing and keep those standards up, but they're going to have to do it. Think about it again, do it again, and do it consistently. And of course, you have to coach the public who may assume it's like the thing is the same as the past. It's not. And so they're going to have to be aware of educating the public to be responsible as well in their engagement with them in the new setting, some of the new norms they have to get used to.
We'll move to our next caller, our last caller. Apologies.
Your final question comes from Mo Fahim with Vista Radio. Please go ahead.
Hi, thank you. Good afternoon, Doctor. My question is more of a checking in with our projections. Understanding that projections are not crystal balls, they don't tell the future per se, or at all. They just give us kind of an understanding of where we're heading and better equipment. The projections put us at about 20,000 cases overall throughout the whole course, and we're currently around 17,000. So just checking in with what the numbers, where we're at right now.
So if we're looking at the modeling projections, I think that's where you're going. If we had been at the track where we were in one of our better case scenarios, we would have been at 20,000 about a week ago. So as a result, we have plateaued that. So that's the good news. We'd like it to come down. So you always have a accruing of cases in that regard. So the fact that we haven't hit the 20,000 yet is good news. And the longer we can stretch that out to keep that under control by reducing the numbers, the better we will be giving evidence of not only flattening, but bending the curve. Our data points and our projections on a number of the things are all, instead of increasing, accruing on a moderate case scenario, are bending towards a good case scenario, and that means a plateauing on that basis there as you go out and spread the days out. And so in that, even in our long-term care homes, it looks like we're starting to plateau and come down a bit on the new cases, positivities, and we're still waiting to see hints a bit at the plateauing of the deaths in there, and we like to see that plateaued and coming down as well. So we're on line with the projections. As you remember, the modelers said with the long-term care is about 2 weeks or so beyond the others, and so they expected it to plateau more around within the first or second week of May, and we're in that time coming up. So I think we're sort of on that mark there, but we would like to keep even being ahead of that if we could and bring it down more assertively. And therefore we're taking very aggressive action in the long-term care homes, as well as really trying to ask the public to be strong on this one and to stay the course so we can even keep that coming down quicker and even be ahead of the projections.
Okay, we'll move to our last question.
Yes. Okay, thank you. My question is, yesterday Dr. Vera Etches in Ottawa recommended that all residents aged 60 or older who may be experiencing symptoms of COVID-19 go get tested at an assessment center. Now, my understanding is that that's the first kind of order of its kind in Ontario. Do you mind commenting on that and whether the whole province is going to follow?
I'm not aware whether it was a recommendation, a guidance document from Dr. Etches, or order. You're starting to sound like it was an order. I haven't seen that. I think asking people, as we have done all along, to say now, even a week and a half ago, we said, as compared to people only severe or fairly extensive signs and symptoms of a narrow base of COVID, the original triad of 3, shortness of breath, cough, and fever, and then we've expanded a number of other symptoms, including the things like loss of taste and smell and other more milder ones. And we said anyone having those can go to the assessment center, get assessed. And I think they're being much more, in all the centers, liberal on who they test, even with mild symptoms. So that wouldn't pertain to just those over 60. It would be other age groups as well. So we haven't given out a directive or order to do that because that's under the all testing. The people have to be willing to get tested and have to want to come forward to get tested. So we would like them to do so, and we have not dissuaded them from doing that. But again, the details, if there was some sort of more structure with Dr. Etch's order or Dr. Etch's recommendation or guidance, I haven't seen it myself, so I can't comment on it at this moment.
Thanks, everyone.